Now, I think this is a lot of people's worst nightmare. Baby is coming and they are coming fast. In the medical community, we call this a precipitous birth. It is a birth that happens within 3 hours of contractions becoming regular. Now, if this is something that you're concerned about, I'm excited that you're here because we're going to talk about how often it really happens and what to do if it ends up happening to you. And I gotta say, I think this was my partner's worst nightmare. He did not want to have to do anything with delivering this baby, which, it could ultimately be their job. It is why it made him very anxious to labor at home, and he was always just worried about this. So if your partner is worried about this, or if you're worried about laboring at home, because if you're in early labor, home is actually your best spot to labor in, come join me in the online prenatal class for couples where we go over what to do in early labor and when to go to the hospital and all these different things. Okay, so precipitous births. The most important thing for you to know is that these are usually the absolute safest births. And as a labor and delivery nurse who was just starting out, that was really important for me to know as well, because I think I delivered my first baby without a doctor within 3 days of going off of orientation at my hospital. We had a lot of providers back in the day who missed deliveries. And so, my preceptors told me these are the safest deliveries. So you have less concern about baby getting stuck or baby having issues, because this is Mother Nature showing us everything is lined up absolutely perfectly. That baby is just shooting out of your body and, it is going to be safe. We're just there to make sure that baby has a safe landing. So this is less than 3 hours of precipitous birth. But in case you were wondering, the average time for a birth is 6 to 18 hours, according to the American Pregnancy Association. This actually comes from a whole post on my website. I'm going to put it down below, and it has links for stuff like that as well. Now, if you have had a previous precipitous birth, it actually can be a reason to be induced. We obviously would prefer that you're not delivering in your car or on the way home. So if you're worried about baby coming too quickly, definitely have that conversation with your provider. Now, another thing for you to know is that there are so many fluids involved with birth. Whenever I had patients who delivered in their car, once we got everything going and dad was just back hanging out in the room, I'd be like, hey, how was your car? Because I just don't know how a car comes back from that. So I think it's a good thing to have a lot of people call them puppy pads. We call them chucks in the hospitals. Honestly, so helpful after baby too. They just protect things and they sop up fluids, and some towels in your car. I think they're great to have just in case your water breaks or whatever's going on with you at delivery. Having some in your car and maybe in your workplace, not to deliver your baby on, but I just think they're super handy. I'm not saying everybody needs to have it, but if you have a concern about it, it might be a good thing to have. Okay, so how do we avoid this? When do we go to the hospital? I see a lot of people on social media giving this golden rule of when you should head to the hospital. And I am here to tell you that so many of you live in different places from your hospital. Some of you live 5 minutes from your hospital, so that's going to be really different than the people who live an hour to 2 hours away from the hospital. That's very different. And I'm here to tell you that I actually worked in a hospital that was right next to a mall. And so on weekends when the mall was busy, especially around Christmas, when you should head to the hospital was very different than when you should head to the hospital on a Wednesday morning. And so I think it's really important to talk with your provider, possibly do some dry runs to see how long it does take you to get to the hospital so that you know when to go in. Fun fact, most providers usually have somebody on for them 24 hours a day that you can make a phone call to. And as a labor and delivery nurse, knowing the hospital that I worked in, I could usually tell if that person was ready to come into labor and delivery or not. So I think that can be a great resource when you're in early labor, is to stay in touch with your provider or whoever's on for them to know kind of when the best point to come into labor and delivery is. But again, if this were to happen to you in your car, the first thing that should come to your mind is everything's lined up and this is the safest way to give birth. Also, get the towels out. This is not a time to panic. This is just Mother Nature taking her course. So I think that can help as well. Editor Hillary here to say that I don't want you to think that I didn't panic in these situations when I was a baby nurse. It can feel very scary, but I am trying to tell you that I think it can be helpful to know that normally everything's just lined up and we're good to go. So I want you to think towards that rather than panicking, because we all know that panicking isn't going to help you in this situation. Just wanted to put that out there. It's not like I'm super brave in this situation either. I do see a lot of moms who have had a precipitous birth who could use a little bit of therapy surrounding it. It can be very traumatic because they're very worried that something is going to go wrong. That's why they are paying to have their baby at the hospital. They didn't want to have their baby in their car. They did not want to free birth this baby. So some therapy can sometimes help mitigate any trauma that you felt, especially if you're hoping to have another baby in the future. And might be a good one for your partner. They may actually be even more traumatized because they just kind of had to watch it and feel really helpless, which isn't a good feeling. Whereas you felt like you maybe had a little bit more control in this situation. So I think it's good to check in with your partner if this has happened to you as well. Okay, so if you think this is you, you're at home, you're in your car, and you think the baby is immediately coming, what do you do? So I should say that you might get this overwhelming urge to push, and that is an indicator that the baby is probably coming, or you feel the baby's head right there. You need to call 911 right away because you want emergency response coming to you. That's going to be faster than you driving faster to the hospital most often, but make sure that you're calling 911 first. Have them on speakerphone next to you, just let them know you think the baby is coming. Then you're going to want to check where the baby's head is down there, or have your partner check to see if the baby's head is crowning. If it is crowning, they can encourage you how to push. If the baby's head is already there, then what you want to do, by the way, this is just entertainment. This is not medical advice, but sometimes this just helps people feel better that they at least have an inkling of what to do to deliver the baby. I know it helped me feel that way. The baby's head comes out. You as a provider are going to pull down to release this top shoulder, and then you are going to pull up, and then baby comes out. Then baby should rest on mom. You want to try and get them skin to skin. The nemesis of a newborn baby is them getting too cold. So you want to make sure that you're drying them off, getting them skin to skin. You can use dad's shirt. You can use the towels that you have, whatever you have, you're trying to dry the baby off so that they're not wet and just out in the environment. You want to make sure that they're staying warm. Skin to skin is a great way to do that. Also, the act of drying them off, rubbing their back, rubbing their feet, usually is what gets them to cry. We don't hold babies upside down and slap their bottom anymore. That's usually what we're doing, is we're drying them off, and those stimulations is what gets them to cry and get the amniotic fluid out of their lungs. So many people wonder, do I need to clamp the cord? And the answer is no. The cord automatically, when it hits air, starts to shut off. And so baby's going to be just fine. You don't need to cut through it or bite through it. No, just leave it intact. And again, you've got 911 on the phone. So you're going to see how far they are out. If you have to deliver the placenta, then that is a whole other bag of chips. But most often the placenta is still inside by the time 911 shows up. As you're drying the baby off, you want to make sure that you're wiping off their mouth and their nose area to make sure that they're keeping that clear so they can get a nice, good full breath without amniotic fluid coming in as well. Now, FYI, baby's hands and feet will stay blue for some period of time. As baby's starting to breathe, they're going to pink up, but it isn't unusual for those hands and feet to remain blue, so don't freak out about that. Again, your 911 operator should be on the phone with you so that they can walk you through anything that you need to do with baby. But most often when baby comes out, as long as we're drying and stimulating them, they'll start to cry and breathe, and they'll start to turn pink. And as a reminder, this happens in very few births, less than 3%. And the majority of those are actually delivered in the hospital, because you got to think it's 3 hours from the beginning of regular contractions until delivery. So most people have time to make it to the hospital. And if this is happening to you, remember that everything is lined up just correctly and that things are going to be fine. I know that helped me a lot as a baby labor and delivery nurse, and I think it'll help you if it were to happen to you, and be sure and let your partner know that as well. This might be a great video to share with them. I think it might just relieve a lot of things in them as well. Now, contractions are not the only sign that we are watching for labor. There's actually some other early signs of labor that I'm going to link to up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth or car birth today.